Hi guys, I'm Dr. Mehboob, MD Ophthalmology from AIIMS New Delhi, and I'm here with my continuation series of Take a Sip with OPHTHA Quick. And in this series, I always talk about that this series is very important for the NEET PG, FMG, next PGs aspirants. Why? Because we discuss the important topics of ophthalmology relevant to the MCQs for the NEET PG, next PG, and FMG examinations. Okay, so it's a very short time. Whenever you go anywhere, you just watch a 2 to 3 minutes video and you will be able to answer maximum MCQs from that topic. So we are here with our SIP 10, that is corneal dystrophy part 1, where we will discuss the definition and the classification. Why I have separated this? Because the definition and the classification, a lots of MCQ is asked over these 2 points only, rather than discussing the important every dystrophies separately. The important thing is that definition and classification is very important. I will be having all the SIPs, other SIPs also about this corneal dystrophies on the different types and individually also, but the most important is the definition and the classification. So let's start. Introduction, you will have to understand that the word dystrophy means there is a dys means something is wrong, and trophy means there is a obviously troph matlab nourishment. Something is wrong to the nourishment of the cornea, and that leads to the disease that is called a dystrophy. This is the dystrophy, 2 words, Greek words, 2 words. Okay, now when we call it a dystrophy, there has to be certain features which is very important for the MCQ also. So it is usually bilateral. It will occur in both the eyes at the same time usually, and most of the cases. Systematic, obviously it is symmetric in both the eyes. Slowly progressive, it is that it does not say that it will appear in 1 day or in 1 week or in 1 month. It's a slowly progressive, it will progress, and not related to the environmental or any systemic factors. There should not be any systemic factor, there should not be any environmental effects of the corneal dystrophy. Then it will not be a corneal dystrophy, right? But there are few exceptions. Obviously biology is a science of exceptions, medicine is a science of exceptions, so you have the exceptions everywhere. So let's see some exceptions are bilaterality. I have told you that the bilateral, it's bilateral, but there is one condition that is called endothelial dystrophy, that is PPCD, means posterior polymorphous corneal dystrophy. It is a type of endothelial dystrophy which is usually unilateral. It may be bilateral, but it is usually unilateral, so it is an exception. Second point is that it does not have a systemic or any environmental factor association, right? But there is Snyder corneal dystrophy. SCD means Snyder corneal dystrophy, where we have it is associated with the hypercholesterolemia. Means sometime a patient is having hyperlipidemia, hypercholesterolemia, and the patient is having a dystrophy, then we can expect that this patient is having Snyder corneal dystrophy. We have seen the patient like this. Hereditary, obviously this should not have the hereditary basis. Generation to generation has to jump, right? But EBMD, that is the most common one, the most common EBMD, most common corneal dystrophy, and it's a type of epithelial dystrophy. Most common corneal dystrophy, epithelial basement membrane dystrophy. In majority of the cases, it does not have the hereditary bias, means they're not having the hereditary things. Okay, but usually the corneal dystrophy has the hereditary thing. Coming to the slowly progressives, I have told you that it progresses slowly, but there is one thing, that is Fuchs endothelial corneal dystrophy is stage 1, does not progress. It does not progress at all. Okay, and we will discuss that the name of this condition has been changed later on because of this does not progression. Okay, we will discuss. Okay, moving to this point, that is we know that we have something called anatomical classification. Let's see this. Earlier on, we have classified this corneal dystrophy based on the anatomy. Like we have epithelial and subepithelial, we have the Bowman's membrane, stromal and Descemet's membrane. Let me tell you some examples. Like EBMD comes to this. Bowman's may Rees buckler and Thiel-Behnke. Stromal, there are lots of things like lattice degenerations and granular degenerations, macular degenerations. and dystrophies, lattice dystrophy, granular dystrophy, and macular dystrophy. And here, Descendants variant endothelial, we have the FECD, that is fused endothelial corneal dystrophy, CHED, congenital hereditary endothelial dystrophy, and PPCD, that we have seen now, PPCD, posterior polymorphous corneal dystrophy. So this was the classification earlier used to be, but IC3D classification, you know, this very important IC3D classification, that is today, in today's world, this IC3D classification is being used for the corneal dystrophy. It has the basis of genetic, clinical, pathological, and representative clinical features. Now it is categorized into category 1, 2, 3, and 4. Very simple to remember. Just see these 3 points, remember these 3 points, and reduce 1 point in each part. We should have in the category 1 all those corneal dystrophies which has a well-defined dystrophies, well-defined gene mapping, and well-defined mutation. They come in category 1, obviously. And in category 2, the dystrophies who has well-defined dystrophies and specific chromosomal location, that is gene mapping, but no mutations known. It is being under investigation. They come under category 2. Similarly, remove this, that the third one only well-defined dystrophy, and the fourth one all those new dystrophy that is about to discover, that is being under investigation, they come into this. So we have to understand that the IC3D classification is a very important classification of corneal dystrophy. So this ends the definition and the classification of corneal dystrophy. Hope you like this, and do continue watch other SIPs, very fun learning, MCQ targeted learning. So thank you very much.